Another way, and again you might need to try this if you don't get a response in that one position, is just to let her arm hang here, support the elbow area, and again I'm going to tap at the triceps tendon just proximal to the olecranon here and look for arm extension again. And look for symmetry on the other side. And you might tell the patient, let everything go loose, let me hold your arm all by myself. So a lot of them are tensing up. It's going to be hard to elicit the reflexes. Okay. The next reflex was the brachioradialis or radial reflex. And I'm going to tap right here over the distal head of the radius bone. Okay. And we could either just tap this area, or I can put my thumb there and look for, again, arm flexion at the elbow. And similarly over here. And note that they're symmetrical. Moving on down, we're going to look at the lower limbs and the patellar or knee reflex. And again, test them just to let everything go loose. And we're going to tap below the patella right here and look for knee extension. Same thing on this side. And now in the seated position, it's a little more difficult to maneuver to get the ankle reflex, but in healthy patients, it often is fairly simple. And I'm going to rotate the foot out a little bit and pull up a little on the sole and tap on the Achilles tendon just above the heel back here and look for plantar flexion. And there's a beautiful response there. And similarly, I'm going to do it on this side. And again, a nice plantar flexion response. And there's symmetry here. The muscle stretch reflexes can be graded from 0 to 4, and you could record this as you're examining the patient. The grade of 0 means there is no reflex response despite any type of reinforcement maneuver. It's no response at all. The grade of 1 means that you get the reflex only if there's a reinforcement maneuver. So for example, if with the knee reflex, I'm tapping here and getting no response at all, I could ask the patient to do the classic Gendrasic maneuver. And if you'll just curl your fingers, pull them together like this, and gently pull your fingers against one another. And then I could tap again here and bring out the reflex. That would be a 1. Okay, you can relax. And without this maneuver, I couldn't get it. Now, normally, reflexes are 2 or 3, or 2 plus or 3 plus. 3 plus being somewhat brisker, but still in the normal range. And 4, the top of the scale, indicates clonus. In clonus, we can demonstrate most easily with the ankle reflex. Okay, and you could see it if you look down here. This is not the optimal position, but if I just push up and dorsiflex the foot at the ankle, I will elicit plantar flexion that'll just keep on going as long as I'm passively pushing up like that. And it's an oscillating type of response. The plantar flexion keeps going. That would be 4 plus ankle clonus. The next thing we're going to do is check for sensation. And there's a few modalities we're going to check. Again, I have my, my broken cotton stick applicator here that I'm going to use. And I'm going to use the wisp of cotton to test light touch, and the broken sharp end of the wood stick to test for pin or pain sensation. But it won't be that painful. So I've got my little stick again. If you can close your eyes for me. And I'm going to be touching you over the body with this. Could you just tell me where you feel me touching?
My left foot, right shin, left knee, right knee.
Are they all pretty equal?
Yes.
Okay, so if I compare these two sides, that's all pretty equal for you, right?
Yes, it is.
Okay, and if I were to take this and just trickle it right up your leg, that's all pretty much the same?
Yes.
One side to the other? Okay. Where do you feel me now?
On my right thumb, left thumb.
Pretty equal on both sides? Okay.
Right wrist, left.
And then we would go up a little more
Right.
proximally.
Left.
Okay, that's pretty equal too?
Yes, it is.
Okay. Let's move back down to the feet. What does this feel to you now?
Sharp.
This is a sharp and pokey
Yes,
sensation. Okay. Is it sharp and pokey over here too?
Yes. Yes.
All pretty equal on both sides?
Yes.
Okay.
Sharp.
Feel it up here too.
Yes, I do.
We could check the pads of the fingertips here. All pokey?
Yes, it is.
Okay. Very good. The next thing I'd like to check, another sensation, would be proprioception. And what I'm going to do is I'm going to take your finger or your toe, and I'm going to move it up or down. And I just want you to tell me what direction you feel me moving it in. You don't have to do anything for me, okay? Okay. We're going to make sure that I'm holding the sides of the digit, because if I hold the finger like this, and as I'm moving, it's the pressure from my positioning here that's going to give her clues as to whether it's going up or down. To really make an accurate test, I'm going to hold along the sides of the digit. I don't want to rub against anything else. I'm steadying this joint right here at the knuckle, and that's where I'm going to be making my movement. Okay? And here we go. Just tell me if it's up or down.
Up. Up. Down. Down. Down.
And just a movement of a millimeter or two is what we could minimally pick up here. We're going to try this finger, same thing.
Up. 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 Down.
Great. Okay, now we're going to move down to the toes. And I'm going to isolate the great toe from the rest here, holding it by the sides. Okay, which way is that going? Up or down? Can you tell?
Up.
If you're not sure, just guess.
Down. Down. Down.
Okay. I'm going to come over to your other foot. Same game over here. Okay. Which way?
Up. 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 Down.
Very good. The next sensation we're going to check is for vibration. So I'm going to use my tuning fork and set it vibrating on my hand. And I'm going to apply it to a bony prominence. It's going to be the medial ankle. Do you feel the buzzing here?
Yes.
Okay. Tell me when the buzzing's all gone. You don't feel it anymore. And I'm feeling it in my fingers at the same time. Damping it out a little.
Now.
Okay, and I don't feel it anymore. Same thing on your other ankle. Feel the buzzing,
Yes.
right? Okay. Tell me when it's gone. I can damp it out a little.
Now.
Okay, very good. Now we're going to check vibration at a bony prominence up here. It'll be the knuckles. Strike my tuning fork again and put it on the knuckle here. You feel the buzz, the
Yes.
vibration? Okay, tell me when it's gone.
Now.
Okay, and it is gone. Same thing on the left. Tell me when the vibration's gone.
Now.
Okay. That's the end of the sensory exam that we're screening. We're going to check for coordination now. And open your eyes for me. What I'd like you to do, take your right index finger, and I'd like you to touch my fingertip and your nose back and forth. Okay? And I'm going to move a little over here. And I'm going to move a little over here. Okay? Let's put that hand down. Let's try it with your left index finger. Same thing. Okay, very cleanly done. Good coordination. Now, if you could hold your hands out in front of you, could you just tap your fingers and thumbs together like that for me real fast? And the rapid movements are well coordinated equally on both sides. That's great. And put your hands down. We're going to check for coordination in the lower limbs. What I'd like you to do is if you could pick up your right heel, put the tip of it on your left knee, and slide it down your shin all the way down. Okay? And if we could do the same thing on the other limb, on your knee, and slide it down your shin. That's great. Okay. At this point, we're going to have to get upright again. So if you could sit up for me, we'll push this in for you. And what we're going to do now is to see if there's a Romberg sign, which is what I'll explain in a second. If you just stand for me like that, like you're standing at attention, put your feet together. Okay. I'm going to ask you to close your eyes in a second, and I'm going to be right here. So, you know, I'll catch you if you're wobbling or falling. Okay. Close your eyes for me. Sometimes older patients get very apprehensive here, and you've got to be close by in case they do tend to fall. And she's not moving one iota. That's great. You can open your eyes. And lastly, for the screening exam, we want to check for gait. And what we would do is just have you normally walk across the room like you're at home. If you could head for that corner of the room and turn around, come on back. And I'm looking for her arm swing and how rapidly she can turn and her balance, more or less. The last screening piece would be tandem gait, or walking heel to toe, like you're walking a straight line. And she does that very well. So that pretty much sums up the screening neurological examination. And one general comment would be explain to the patient each step as you're preparing to do that so they know what's coming up and what they should be doing